Hello everyone, welcome to MedDevice. In this video, we're gonna be looking at a few previous year questions from the subject of obstetrics and gynecology. So let's start with the first question. During a recent examination, a 45-year-old female patient reported an uncomfortable lower abdominal mass. Despite no apparent issues in the adnexa and a uniformly enlarged uterus, an MRI discovered the presence of a myometrial cyst. Based on these findings, what is the most likely diagnosis? Is it leiomyoma, endometrial hyperplasia, adenomyosis, or endometriosis? So, the main key points that you have to see here are uniformly enlarged uterus and presence of a myometrial cyst. So, let us go through the options one by one. What is endometriosis? It is a condition where the endometrial tissue goes outside of the uterus and does not go within the myometrium, which is different from the presentation of the patient where she has a cyst. Endometrial hyperplasia manifests with abnormal uterine bleeding, and nothing as such is mentioned here. Finally, we have leiomyoma and adenomyosis, and you might get confused between these two options. So let's see how to differentiate between them. So, leiomyoma is a benign smooth muscle tumor which is also known as fibroid, and it occurs within the myometrial layer of the uterus. Adenomyosis is when the endometrial tissue grows into the muscular wall of the uterus. So, both are occurring within the myometrium. But in leiomyoma, there is a well defined and solid mass, and very importantly, it does not cause diffuse uterine enlargement. The enlargement happens at one particular place. But in adenomyosis, this causes uniformly enlarged uterus. And this is exactly what was given in our question. So, for example, here you can see that whenever the endometrial tissue goes inside the myometrium, it causes a uniformly enlarged uterus, which leads to adenomyosis. So coming back to our question, our correct option is option C. Now, what is the expected level of the anti-Mullerian hormone in individuals with low ovarian reserve? Is it less than 1, 1 to 2, 2 to 4, or 4 to 6? So what is anti-Mullerian hormone? It is a glycoprotein hormone which is produced by the granulosa cells of developing follicles in the ovaries, and this hormone is an indicator of the woman's ovarian reserve, meaning number of eggs remaining in the ovaries. So if the woman has a large ovarian reserve, the anti-Mullerian hormone is also going to be high. So above 1 nanogram per ml, this is normal. If it is below 1 nanogram per ml, it is low. And this is our answer. Additionally, you need to know that if the value is very high, particularly above 4 nanograms per ml, it indicates a disease called PCOS or polycystic ovarian syndrome, because in this condition there are a lot of follicles. So coming back to our question, our correct option is option A. Identify the hormone that acts on the post-ovulatory endometrium. Is it estrogen, LH, FSH, or progesterone? So this is a very simple question if you know the cycle. So here you can see that in the middle, meaning on the 14th day, we have the ovulation. So the question is basically asking which hormone acts on the uterus after this day. So according to this graph, if you will follow the blue line, you can see that the progesterone is increasing after the 14th day. Here we have the ovulation, here we have the progesterone which increases after the 14th day, and so our correct option is option D. Now identify the absolute contraindications to OCP use. Is it thromboembolism, chronic renal disease, history of amenorrhea, or diabetes insipidus? So I have an important list for you here that you have to remember the contraindications for OCP use. So these include the pregnancy, breastfeeding, liver diseases such as hepatitis, cirrhosis, hypertension, ischemic heart disease, also active breast cancer, diabetics with neuro or nephropathy, and finally our answer, deep venous thrombosis or pulmonary embolism. This is an important MCQ that you have to remember. Coming back to our question, our correct option is option A or thromboembolism. This is an absolute contraindication since using this drug also increases the chances of thromboembolism. Now, what is the prescribed dosage of ulipristal for emergency contraception? Is it 30 mg, 40 mg, 60 or 100? So what is ulipristal? So it is an emergency contraceptive and it is given as only one tablet of 30 mg. It should be given within 5 days but as soon as possible. What is the mechanism of action? It has an anti-progesterone effect. So coming back to our question, our correct option is option A. At what time is it ideal to conduct nuchal translucency evaluation? Is it 6 to 8 weeks, 14 to 16 weeks, 11 to 14 weeks, or 16 to 20 weeks? So what exactly is this nuchal translucency test? So it is a test where we measure the fluid at the back of the fetal neck. It is a non-invasive procedure and it is a screening test. And the thickness that we find out after doing this test tells us about the risk of chromosomal abnormalities like Down syndrome. And it is performed between 11 to 14 weeks, which was our answer. So coming back, our correct option is option C. The use of magnesium sulfate appears to be ineffective in which case? Prevention of seizures in severe preeclampsia, prevention of recurrent seizures in eclampsia, prevention of RDS in premature babies, or reducing contractility of uterus. So, what is magnesium sulfate and what is its use? So, it is used for prevention of seizures in preeclampsia and eclampsia states, and it also relaxes the uterine smooth muscles by competitive inhibition of the action of calcium. So if we will go back to our question, option A, B and D are eliminated and we are left with option C. So this is our correct answer. Vulvar atrophy and itching are treated by estrogen ointment, antihistamines, tamoxifen, or none of these. So vulvar atrophy is caused by a decrease in the estrogen levels, which will lead to dryness, thinning, and inflammation of the vulvar tissue. Estrogen ointment helps to replace the lost estrogen and will help to normalize the vulvar tissue. So in this case, we will use option A, which is estrogen ointment. Finally, what is the chromosome number for a partial hydatidiform mole? Is it 46XX, 45XO, 46XXY, or 69XXX? So what exactly is a partial hydatidiform mole? Let's see. So let's say here we have an egg which is being fertilized by a sperm which also has eggs. So normally this would give rise to a girl. But let's say another sperm comes which also has an eggs and somehow enters the egg. This would lead to the formation of a zygote with 3 sets of chromosomes and 3 X's, or in other words 69XXX. And this is what was given in our options, so our correct option here is option D. That's it for this video. If you have any doubts, so please leave them in the comments, or you can message me on Instagram anytime. The link to my Instagram is in the description. Thank you.